Ahead this half hour, inside the hospitals, we get perspective from a leader with Catholic Health about the impact the rise in COVID cases is having and what's ahead for them.
Plus, the Verify team getting answers for parents and showing you the process of getting vaccine doses for children.
And we're talking live with a woman working to give senior dogs in Western New York their own homes to enjoy their golden years.
We're glad you're here with us on this Thursday. Western New York hospitals are dealing with a lot right now. The surge in COVID cases, a nationwide staffing shortage, even the ripple effects of the months-long Mercy hospital strike in South Buffalo that just came to an end last week.
We want to get a look at where things stand and where they're headed for hospitals, because any serious strain can have a real impact on anyone who needs help. So we want to show you some of the headlines right now. The state says there are now 307 COVID patients in Western New York hospitals. That's been steadily rising now for weeks.
The majority of those patients of the 307 are in Erie County. You can see 205 of them. That's according to the local health department. The CDC says between last Wednesday and this Tuesday, Erie County had 187 new hospital admissions for COVID. That makes it one out of only 37 counties in the entire country that had more than 150 new admissions during that time period.
Tonight, we're also looking specifically at Catholic Health. The intensive care units at Catholic Health's 4 hospitals are at 95 to 100% capacity. Other hospitals are seeing the same, and it's clearly a concerning issue.
Joining us now is Dr. Kevin Shiley, Catholic Health's Medical Director of Infection Control. Thanks for being on. I know it's a really busy time for you.
Oh, no problem, Michael.
And to start out, we mentioned your ICUs are almost completely full. So can you give us an idea of the state of Catholic Health hospitals right now? Because most of us hopefully won't be there in person to see the effects firsthand. But what is the surge doing for doctors and nurses? How are they dealing with it every day?
Well, sure. As you mentioned, we're about 95, 100% at capacity right now. And that's obviously concerning, I think, for the entire community. As far as our nurses, our doctors, and our other caregivers, we're well acquainted with COVID at this point. We've been doing this for a while. We know how to take care of these folks, and that's honestly one of the best ways to cope is to know that you kind of know how to deal with the problem. That said, it is a little frustrating for folks when despite all of our best efforts, some of these patients unfortunately just don't make it, and that is always heartbreaking for every staff member when we can't get someone out the other side of this.
And Dr. Shiley, a question that we keep hearing from a lot of our viewers is, who are the people who are ending up in the hospital right now, and especially ending up in the ICU? Are they vaccinated or unvaccinated? How old are they? Have they had boosters? What are you seeing along those lines in terms of what's happening inside those hospitals?
Sure. So there's a distinct break in what we're seeing. So if you look at patients that are admitted to hospital and they're under age 60, about 80% of them are unvaccinated. So there's a huge opportunity in that group of people still really to help prevent serious illness. So kind of an important point. As far as people older than 60 years old, more over 65, we start to see more of a 50-50 split between vaccinated and unvaccinated. Among those vaccinated people, nearly all of them have not received booster shots, and that's partly why there's really been such a big push to get particularly people over 65 booster shots.
And we know that for a long time, Catholic Health had the Sisters of Charity St. Joseph campus as a COVID-only hospital, and that ended in the late spring when the numbers were a lot lower than they are now. Do you think that Catholic Health may have to consider making that change again and needing those beds?
I think Catholic Health has to remain nimble. And right now, where we are with how we're managing our patients, I think we're handling it. But who knows what could happen in the future. I think the key point, though, is that we really developed a pretty good system with our current sites in terms of managing our COVID patients. But you always have to keep options available. We're serving this community, and we have to always keep in mind any kind of creative ways we can handle it if things get worse.
And Dr. Shiley, I know that you've made some decisions lately in dealing not just with this surge, but also staffing shortages with what you did at your facility in Orchard Park and focusing those resources on South Buffalo Mercy Hospital. We talked first at 5 about a new SUNY scholarship program today for 1,000 new registered nurses. Seems like a start, but we still know that the shortage is there. How much is that affecting Catholic Health, other hospitals here locally at a time when we're seeing more people ending up in the hospital?
Yeah, staffing shortages are a huge issue. That, we could have a lot of beds available, but if we don't have the staff to take care of those patients, that really limits our capacity and our ability to care for patients. Catholic Health is actually taking quite a few things on here to try and attract more staff to our ministries. In fact, we actually now are offering up to a $20,000 bonus for some nurses coming to some of our sites. So that's a great opportunity, but we also have a lot of other opportunities. We have, in addition to signing bonuses, we actually have bonuses for our internal staff for making referrals. And we're certainly partnering up with a lot of the schools in the area to attract more people early on before they even graduate.
Dr. Shiley, this is kind of an opportunity for you right now as a member of the medical community to address the community directly. What would you say to them right now about where we are in this in terms of COVID and what we need to do?
Sure. So I think we have to just kind of stick to what we know. And, the key things here, I mentioned earlier, for our patients under age 60, 80% of our patients getting admitted to hospital under age 60 are unvaccinated. So if you haven't been vaccinated yet, we really, really want to encourage you to go out and get vaccinated. If you have been vaccinated, but it's been more than 6 months with one of the Moderna or Pfizer vaccines, and you're eligible, please go out and get a booster. That'll help protect you further, and it will also help protect the people around you further. If you've received a Johnson & Johnson vaccine more than 2 months ago, I would strongly encourage you to get a booster as well. These are really, really strong ways to help protect you and the people you love around you. I'd also just encourage people to consider who they're around, and particularly with the holiday coming up. There's a lot of opportunity for transmission coming up with the holiday. And, if you have someone coming to your home for Thanksgiving, be thoughtful about, the vaccine status of the folks coming in, who you're inviting. And if there's a really, really high risk person with underlying significant problems with their immune system or chronic medical conditions, they may want to consider the types of gatherings they're going to be part of.
I just went online today and booked a booster appointment. It was quick, it was easy, and again, it is now open to everyone 18 or older, at least 6 months after getting the final dose of their vaccine. Dr. Kevin Shiley is Catholic Health's Medical Director of Infection Control. Thanks for coming on and sharing your thoughts.
No problem. Thank you. Take care.
And now that kids as young as 5 are eligible to get vaccines, we know parents have a lot of questions about those shots and the process for getting them.
And that includes the dosage kids are getting. So Evan Kozloff and the Verified team have some answers about that tonight.
This tiny vial right here is the COVID-19 vaccine for kids. It's tiny. In fact, this is 10 doses of that vaccine. And we've heard from parents who are concerned about getting the right dosage. So we wanted to verify, and that's why we came here to Grubbs Pharmacy, who showed us the process step by step.
It's been a very pleasant chaos.
Dr. Michael Kim is the owner of Grubbs Pharmacy, and he's taken us through the process that we typically don't see, getting the vaccine ready for us.
When it arrives, we open it up and it's just frozen. Once it arrives, we've been directed to take it out and put it straight into the refrigerator.
That's so it could thaw before using it. And they should be easy to spot. The kid vaccine has an orange cap and a label with an orange border to distinguish from the adult version.
Then we're going to take a syringe.
The next step is the dilution process, using 1.3 milliliters of sodium chloride.
And then we're going to take the vial of the actual COVID vaccine. And we're going to add this 1.3 mLs to the vial.
Once the sodium chloride is added, pharmacists are trained to mix it all together by doing this turning motion. Finally, it's injection time. They use a syringe to grab 0.2 milliliters of the now diluted vaccine.
And that's it.
a process being done by thousands of pharmacists across the country.
We can show you the entire process and walk you through, hold your hand through the whole entire process.
And Dr. Kim says that if you have questions about all this, of course, just bring those questions to your doctor. The 7 Kozloff with your Verify.
Have to admit, I had no idea that they diluted it,
Right.
and that was how the process worked. It's also smart that they color code them. That takes away room for error.
Yeah, it's such a good point, too, that any questions you have, because we have a lot of great information that we provide you here, but of course, chat with your doctor as well.
Always a good idea.